While I was pregnant and getting chemo, one of my chemos stopped working, and I immediately knew.
Yeah.
The doctors, had no idea. And I went to go for chemo one day, and I told her, I said, this chemo is not working anymore. And then when you go there, do your own research and ask them, challenge your doctor. You have to be your own advocate. And I believe you guys know that too. Doctors don't know everything. You have to be your own advocate. And then, I'm just keep fighting through it.
Yeah, that's what we always say. We say that, doctors are obviously experts in the cancer and the treatment and the diagnosis and all that, but you are the expert in yourself.
Yes.
And we can never lose sight of that, because there were so many times along my journey that I felt things that I'm like, this is not good, this is not right. And I would bring it up. And I mean, to their credit, there were times where they listened very well, very intensely, and we ultimately decided, hey, we need to go this direction. And it was not the right direction, It was, and if I had just held more steadfast, maybe certain things wouldn't have happened. But you never know looking back. I mean, maybe if maybe other things would have happened. So you never know. But I do think it's always worth understanding that we are the expert in ourselves, and especially when you go through something like cancer, you become so hyper aware of everything happening in your body.
Yeah.
Like every little tweak, every little pain, every little, this doesn't quite feel right. You become hyper aware of that. And we have to be able to advocate for ourselves and bring that up to our physicians, because, good, bad, or whatever, it's how the system is set up. Like, these doctors are seeing many, many patients a day, and they're, to no fault of theirs, it can be hard to focus 100% on each individual patient, and then they've got lives and challenges of their own. So the more we can be that voice, be that advocate, I think it's always going to be beneficial for both us and the doctor as well, because the more we tell them about, the more they'll be able to take into consideration in helping guide our decisions. So
while I was pregnant and getting chemo, one of my chemos stopped working, and I immediately knew. The doctors, had no idea. And I went to go for chemo one day, and I told her, I said, this chemo is not working anymore. She was like, what? And a little backstory, my breast cancer, my tumor was creating fluid, and so my breasts would just keep growing and growing, and monthly I would go and get it drained. And while I was on chemo, the fluid kind of slowed down. Well, one day I woke up and my breast was just huge, and I was like, the chemo stopped working. And then they did some tests, and they're like, wow, yeah, you're right, the chemo is not working. So then I had to go in for emergency surgery while I was pregnant to get my breast removed and remove that tumor, because they were like, there's no other chemos you can do while you're pregnant. This was your only option. So the other option is to have surgery. And I was 32 weeks at the time. And I was like...
You went into surgery at 32 weeks pregnant.
Yes.
Oh,
yeah.
My gosh.
And I talk about fear. That's when I was scared. Yeah. And I was like, take the baby. And they're like, no. And I'm like, babies are born at 32 weeks all the time now. He'll be fine. Take the baby. I'm not doing surgery while I'm pregnant.
Yeah.
And they're like, no. And so my surgeon, he was like, listen, I've done surgeries with pregnant people. Like, I promise you don't want to have your baby this early. Yeah. It's better for him to stay in longer. And so I finally was like, okay. And so it was a 5-hour-long surgery, and I had a team, obviously, and then they had a team for my baby. They, anywhere I went, that little baby bed in the hospital that they put your baby in went with me.
Yeah.
And it was in the surgery. Yeah. And I fully expected to come out of surgery either with my baby, because I thought something was going to happen, or, hey, something happened and the baby's stopped breathing, the baby's heart, and we got to take him, something like that. And I came out, and they said his breathing never stopped, his heartbeat never, nothing ever happened to him. And then 2 weeks later, I had him at 34 weeks.